Computer. Take it away, Peter.
Okay, so I'm going to try and share the screen and see if I can get the right PowerPoint. I seem to have quite a few there. Interesting. And let's see. Let's do it from the current slide. I'm assuming everybody can hear me. And from the current slide. Right, so last time we spoke about Alligin, I went through the whole story about allicin. I'm not going to do that tonight. I'm going to concentrate very quickly on its use as a natural antibiotic. Allicin is known as nature's antibiotic. It's been described that way for well over 50 years. It has a very broad spectrum of activity, which means it kills both gram-positive and gram-negative bacteria. So that's anything from E. coli and Salmonella to nasty bugs like Acinetobacter baumannii. But we'll talk very briefly about those in a minute. No one's ever reported any resistance to garlic or allicin, and that's a very important point to take on board because, as you know, antibiotic resistance is now, it's happening every day. There are more and more antibiotics that have basically been kicked out by the bacteria. They're useless to use on infectious episodes because they simply cannot work because the bacteria have developed resistance to them. We haven't really seen that with allicin, although from experience and from some recent history with one or two of our colleagues, we know there's one or two strains that appear to be quite difficult to kill, and there are ways and means around that, but it does take a long time. So at the moment, we don't really have any general resistance reported anywhere in the world, and basically that's because of the way it works. So you remember that bacteria are quite small, not as small as viruses, but they're only small molecules, and the allicin is also very small, so it can come along and actually penetrate the cell wall of the invasive bacteria. And by doing that, it gets inside the bacteria. And once it's inside, it then prevents the release of enzymes from the bacteria that the bacteria needs to replicate. So it's a very clever way of preventing a bacteria from replicating. Now, antibiotics don't work like that normally. What they do is they're much bigger molecules, and they come along and they stick on the outside of the bacteria at various receptor sites. And that's usually, believe it or not, at number 3, number 7, and number 11 around a clock. And there was a very famous perfume released by one of our big chemists many years ago, which was 4711. It was called 4711. So that's what antibiotics do. They bind on receptor sites, and once they're there, that is how they kill the bacteria. But bacteria are very clever, and what they do is they move the receptor sites around a little bit, and that means that those bacteria then cannot bind, and therefore they are basically unable to kill the bacteria. They become resistant. So it's a very simple system, and everyone understands it, from manufacturers, distributors, microbiologists in particular. And they all also know that a lot of problem infections appear to be solved with allicin. So there are quite a few hospitals around the world that buy it now, and they use it for awkward infections like Acinetobacter baumannii and MRSA, MRSA, methicillin-resistant Staphylococcus aureus, and various others like Pseudomonas aeruginosa and various other bacteria that are killers, basically. If you don't get rid of them, they will kill you. So, you really do need something that can kill out these problem infections. We know, obviously, that allicin is natural, safe, and effective. It comes in two forms where it can be used as an antibiotic. Obviously, as the capsule form with Alligin, with ginger added. Ginger is added because it's also a very good antiviral, antibiotic. It's very good at boosting your immune system as well. And your immune system is completely involved in the way that you deal with bacterial infections. You need a strong, functioning immune system to be able to wipe up the bacteria and cleanse them from the blood and help you heal the infection. So here are some of the bacteria that we know allicin kills very quickly and very easily. So starting at the top, you have Streptococcus pyogenes. Just 16 parts per million kills that bacteria. And in every capsule of Alligin, you are generating around about 200 to 250 parts per million of allicin. So therefore, you know that if you use it for long enough, you will kill out Streptococcus pyogenes. The only problem is pyogenes is the flesh-eating bacteria. So you've got about 30 minutes to be able to make it effective. So either a big dose of Alligin, by that I mean 10 to 12 capsules in one go, and then repeat it every hour. Or there are, unfortunately, from our point of view, quite a few antibiotics that can actually kill Streptococcus pyogenes really quickly. Staph aureus we'll come back to in a moment, but then Listeria, E. coli, Salmonella. Those you can imagine are all linked to food products. It can be poorly washed spinach, it can be undercooked meats, it can be badly cooked eggs or uncooked eggs that carry salmonella in particular. Unfortunately, across America, quite a significant percentage of your chickens and your eggs do carry salmonella. So that's why one always gets a little bit nervous if you're using raw eggs in any kind of recipes, because you really won't know whether that egg is carrying a salmonella or not. And then the other two, Clostridium and Helicobacter. Well, Clostridium is a nasty bug. You don't want to catch that. It is a killer. And Helicobacter pylori, as you probably know, is the one that's related to stomach ulcers and stomach cancer. And the pharmaceutical industry are very good at giving you 3 antibiotics that will kill out 1 in 4 infections of Helicobacter pylori. So 25% effective. Compare that with Alligin, and Alligin will be about 85% effective. And that's been proven by a bunch of naturopaths in Austria, of all places, where they used a protocol that we designed to kill out Helicobacter pylori very successfully indeed. So if we're going to finish the last few minutes on Staphylococcus aureus, the golden bacterium, when we look at it under the microscope, you can stain it red and it looks like a bunch of grapes, which is the other name for it. But it is a very interesting bug. It's what's known as a pus-producing cocci. So on the pictures here, the bottom picture is a typical Staph aureus open wound, where you've got this pus that's literally leaking out of a wound, and it just won't stop. It's quite revolting, really. And this could be methicillin sensitive Staph aureus, or it could be methicillin resistant Staph aureus. And it's the MRSA, which is the one that kills. And these are quite old figures now. We actually lose about 8,000 a year now to MRSA infections. But in America, it's going to be something like 10 times that amount. So it does kill an awful lot of people. They're known as superbugs. They're not that easy to treat. There are 1 or 2 antibiotics that can have some effect on MRSA. One is called vancomycin, which unfortunately is more toxic than the bacteria itself. So they have to measure your blood levels of vancomycin every 15 minutes. Otherwise, you're likely to die from taking too much antibiotic rather than being overwhelmed with a bacterial infection. And it leads to led us to human volunteer studies that developed headlines like this: superbugs, is garlic the new lifesaver? Boffin finds garlic can save lives. This is my colleague, Professor Dr. Ron Cutler. And on the left here, the first case that we cured was Deborah Brown. Garlic ended my superbug horror. She had 2 holes in the back of her back that wouldn't heal. They were leaking pus. And the doctors knew, therefore, that the metal plates were infected. So they wanted to bring her back into hospital, rip everything out, and replace all of the plates. She didn't want that to happen. Her mum read about our antibiotic work, and we basically got hold of Deborah, and we gave her the capsules and the first production of the gel, the Alliderm gel. So she took capsules, plenty of them, 10 a day, and she put some gel over the wounded areas. And within just a few weeks, they basically cured. They healed. We then tested the area, no MRSA present at all. And we then moved on and did a whole load of studies. And this young lady, this is a 14-year-old patient, similar thing, 2 pins were inserted, 2 little tiny holes developed. There was a 3rd hole here you could see that healed, but these 2 wouldn't heal. She was like this for well over a year. She just took capsules, and basically after about 8 weeks, we retested her, and she went from double positive MRSA to negative MRSA, and both the holes healed over. Very successful. Here you can see they have healed over completely, and that was just using an oral treatment, no MRSA. And then this is the most severe case that we've ever treated successfully. This lady used to go dancing, but she was diabetic. She went into hospital with gangrene and they cut her foot off. And then unfortunately she caught MRSA and they had to cut her leg off above the knee. And that just would not heal for about a year. She was in hospital. They got fed up trying to look after her because she was costing a lot of money. And they basically sent her home like that. And again, her daughter read about what we'd done successfully. And this lady was treated with gel, with lots of capsules, and she was on multiple drugs as well. And none of those drugs were affected at all. And basically, she got her life back within about 3 months. And you can see it's all perfectly healed. You can see it's clean, it's not infected. And she can now put a caliper on that leg and she goes dancing again like she always used to. So that's the end of the presentation. It's a very interesting product. Again, Alligin is unique simply because it has allicin plus ginger. And have I stopped that now, Jessica? Yep. Okay, that's cool. So that's the end of the talk. And over to you for any questions or concerns about anything, to be honest. I don't mind, I'll answer a question on anything to do with allicin or Alligin or Alli-C or Heart Life or anything really.
Thank you, Peter. Who in here uses Alligin? Mary, I'm pretty sure Jan does. And Renee shared that she's been taking it for some time. I know Lucas was using it for a little bit for some stomach upset. And I use Alli-C, but would anybody like to share their experience or the benefits of Alligin in their life and health? Go ahead, Lucas.
Yeah, I'm Lucas, and I just found that it was a lot more agreeable for me for my stomach. I have a really sensitive stomach, and it was one that I could take and it didn't bother me at all. And yeah, and then I've noticed, I think when Jessamine was teaching, my partner was teaching, she would get sick a lot and I would take it whenever it like come, she'd end up catching something. I would start taking a lot of it, and even living together, I wouldn't get sick. That was what I was pretty amazed by. And I wasn't much of a supplement person before that. And then now I kind of become a believer. So thanks.
It's very good preventative, Lucas. It's actually boosting your immune system and increasing the number of CD4 T cells, the killer cells that get released when you are becoming infected. So that's probably why you didn't pick anything up. Your immune system was functioning at a slightly higher level, which is great. And it's interesting what you said about it must have been the vitamin C that would upset your stomach. It does that quite often. And I actually did a clinical trial on it some years ago to show that there are 1 or 2 forms of vitamin C that are less aggressive on the gut, but inevitably they all seem to upset some people. And maybe it's just like you said that your digestion is super sensitive, and so you get on well with Alligin. That's great.
Thank you, Lucas. Janet, did you want to share something?
Yeah, I just wanted to share that I've been using these products for many years now. And I was already a kind of a big supplement taker, but still at that time, I would occasionally catch a tonsillitis or a cold. And as I got into the allergen, I found that, should I feel something like that, I would take about 3 of them and lay down for a little bit. And usually after a short rest, I would feel, normal again. And so then as years went on, I really have been very blessed not to have too many issues, health issues. Although one time I was in Mexico and I got some sort of bacterial infection either through food or through square dancing with a bunch of people, I don't know, somehow. And Peter came to my rescue suggesting I do a whole bottle of them. And I had been very sick all week and hadn't been able to keep anything down. So I still had my daily packets I had plotted out, and I pulled out all the Alligin capsules and made as much as I could of a dose. Took that, that helped me get home, and then where I had my stock of bottles, and I started for a couple of days taking a whole bottle, and I got through that thing relatively quickly after I added the Alligin. I had actually spent a night in the hospital in Mexico and being pumped with all kinds of antibiotics and all kinds of hydration and things. And so I felt like it really saved the day, even though when I left Mexico, I still felt terribly sick. By the time I got home to my allergen capsules, I was much, much better very quickly. So anytime, I mean, now I usually just take one a day as a preventive measure of anything like that that could be creeping around. And I just do very well with that and very rarely need more than that. But it does so many wonderful different things. And then the gel too, I've used for years in many applications. And when COVID first started, I was using that as my protective factor, putting it in my nose to ward off anything that happened to get in there, and using it as a hand sanitizer. So it's always been very good for us.
Thank you so much, Janet. And Peter, is it possible to take too much Alligin or Alli-C?
Not really, Jasmine. You can take something like 600 to 700 in one dose, and that wouldn't have any detrimental effect on your body, your bloodstream, or any of your vital organs at all. It is an incredibly safe, well-tolerated product. And I remember that episode that Jan just discussed. She was very, very poorly. And we didn't think it was going to work in the end, but eventually it did, and she got better quite quickly. So there's no real limit to the number you can take. Obviously, cost is a factor, but at the end of the day, if the bug refuses to shift, it's always worth trying to double the dose just to see if you can shift it. And that's the best advice I can give is don't worry about taking too many. You can't really take too many. And at the end of the day, you may just be able to push out whatever infection it is, whether it's viral, bacterial, fungal, or a combination of all three. Then you may need quite a significant amount of allicin to be able to shift it all completely. We've had quite a few patients with, for example, head injuries where they've had an open wound on the head. I remember one was a very small girl, and we persevered with her for about 5 months, but it was the only thing that gave her any relief, and she did actually heal it all over in the end. And the parents were so happy at the end. It was incredible.
Good.
So yeah, very good.
Thank you. That's good to know. I know I sometimes have taken 10 or 12 at a time when I feel something coming off and on, and knock it out in a couple of days most of the time. But Mary, did you want to share anything?
I couldn't figure out how to raise my hand. I don't know, the Alligin is which one? Because is that the multi?
It's the one that has allicin and ginger, and it helps with anti-inflammatory as well as digestion.
Okay, I have not tried that.
Oh,
I have
good.
not tried that. I thank you, though. I will definitely get that ordered. I have just been introducing it to a lot of people lately, and they have some questions. I didn't know. I don't want to hog the call, but I was going to try to ask them quickly.
Yeah, sure.
So I have one woman who had COVID, and I got it to her, and she did empty them and take them and drink them down, and she wasn't able to sleep. And the very first night she emptied 6 capsules and drank it, she slept all night long, which is,
Wow.
I thought was interesting. That wasn't what I was expecting to hear from her, but so does it have a parasitic effect?
Which product was that?
Is it a parasitic effect?
Yeah, sorry, which product was it?
Oh, it was the Alli-C, because that's all
Oh.
I had. Yes.
So you asked, does it have anti-parasitic effect? Yes, very much so. So it's very good at getting rid of tapeworms and hookworms and lungworms. All manner of parasites are removed with allicin very, very easily. So yes, that doesn't surprise me.
Is that dosing okay for her? I mean,
Yeah, sure. As a general rule of thumb, it's 3 to 6 capsules in a day if you've got something wrong with you. If you're normal and fit and healthy, 1 to 3 capsules a day is more than enough. If you're over the age of the menopause or over 50, shall we say, then
Okay.
3 capsules a day is better, because your immune system is beginning to suffer a little bit as you age. And if you're younger, then 1 to 2 capsules a day is more than enough to keep you fit and healthy and prevent you from picking up infection from your colleagues or from traveling in large groups or being exposed to viral infections, shall we say.
well, if the person has COVID, would taking 3 to 6 be enough? I mean, I usually, if I'm coming down with something, I take 6, boom, of them
Good,
just
good.
right away. My kids all have their own supplies, and anyway, so it's okay to kind of use your intuition too.
Yeah, the reason we say this is that we can't afford to go and do what are known as dose dependency studies. That's
Right.
what all the drug companies do. So they know exactly how many of each drug you need to kill out things.
Right.
All we can do is give a guide, because we don't know what you've got or what you've been exposed to.
Exactly.
If you were here in my office, then we could do some tests and determine what was actually infecting you. So all we do is give guidelines, and yes, it's down to you to interpret whether you need a few more or a few less. And at the end of the day, the chart I showed shows that we have tested it against lots of bacteria, and we know that very small amounts of allicin are required to kill out those bacteria. But it doesn't tell you how many capsules you need to take, because I can't tell you how many billions of those bacteria you might have in your bloodstream. So that's the way it is. It's you have to experiment, but once you know you can take as many as you need to, most people work out exactly how many they need, and they get it to work perfectly.
Okay, so with COVID, so you mentioned something about treating, and you also mentioned last time about the shedding. This helps actually protect other people because we're not shedding and using the gel and the Alli-C. Is that correct?
That's correct. So what happens is the gel will capture the virus as it enters the nose, and it will stay in the gel layer until all the mucus in your nose clears that gel down into the gut, where any COVID would be automatically destroyed, any that's left, by your stomach acid. So what it does is, whilst it's trapped in the gel layer, it won't allow you to release the virus to anybody else. So that means that you stop shedding the virus. And at the same time, it will block that virus and stop it from continuing to replicate. If you didn't have that extra gel layer in your nose, what would happen is COVID or any other virus can come in and start replicating in your nose very, very, very quickly. And as soon as it does that, it spreads to the general circulation and you get a cough or a cold or the flu, right, etc. So we now know that it can get captured in that gel layer, and normal, it's called mucociliary clearance, will continue to wipe down anything that comes in and gets trapped by the gel and take it down into the gut, where your stomach acid will kill anything like that really, really, really easily. So it's a very good thing to use if you're what's known as a super spreader, or if you're concerned that you've had 2 vaccines and you still caught COVID. There are so many people like that nowadays, you know, where they've been vaccinated, but they still catch COVID and they get sick. Maybe not quite as sick as they would do, but they get sick. And that means they can pass it on. They still have to isolate. But if you've got gel up there, the chances of that happening now are almost zero. The results that we can't talk about yet because they're going to be published show that after 3 days, 99.99% of the virus is no longer there.
Okay, so now the application, I know, and she shows it on the thing, it's just at the edge of the nostrils. You don't have to put it in the nostrils.
You can put it straight up the nostril, yeah. I mean, most people are a little bit scared of doing anything with their nasal passages. You know, some people don't like to touch them even. So that's why we say a little bit of gel on the little finger, close one nostril, push it up.
Oh, okay, got it.
As far as you can, and then squeeze it up a bit further, and then do the same with the other nostril. That's the best way to do it.
Okay. Blood.
And if you leave a little bit around the edge of the nose here, that's a good thing too. There's actually a product that relies on you doing that. I think it's a honey-based product, and it's designed to catch allergens as they come into the nose, like pollen, grass pollen and tree pollen. So you can do exactly the same with the gel, and that'll stop viruses and bacteria and funguses from coming into the nose anyway. And being aloe vera, it's nice and gentle and smooth on the skin.
Yeah, Mary's referring to a video that I made of how to apply it. You just put a little dab on, and I actually do put my finger up my nose.
Okay, I didn't notice. Okay.
But I'm glad you didn't notice. Maybe, I don't know.
And children can do this. We can use this for children.
Very much so, yes. There's no lower age limit. Shall we say 3 years? Below 3 years, you should talk to gentlemen, discuss what the case and the problem is, and if necessary, talk to myself. But over the age of 3 years, no problem at all.
Okay.
And Peter, my mom was reminding me you can also put it in your ears, right? And any orifice besides your eyeballs, correct?
Yes, exactly. Any orifice except your eyeballs. So that does include the ears for glue ear. And by the way, the bacteria that cause that kind of infection in the ear, believe it or not, as soon as you put a foreign substance into the ear, whether it be a drug or an oil or the gel, those bacteria talk to each other and they decide to transmit over to the other ear. So you've got to treat both ears. It's called quorum sensing, and it's a genuine effect that bacteria can communicate using signals with each other, and they can move away from an agent that's designed to kill them.
Okay. Wow. So another question was, if people are on blood thinners, I read this. This is amazing on your heart formula.
Oh yeah.
And so people I told them I can't imagine they couldn't. I know that that it has, you know, blood thinning effects, which we probably need. But if people are on blood thinners, they can still take the heart formula.
Yeah, technically, it does not thin the blood.
Okay.
It does not reduce the number of red cells. Basically, what it does, it is improves the mobility and motility of those red cells so that they can get around the bloodstream faster. Okay. Sorry.
Oh, that's okay.
So no, it's not a contra indication with a blood thinner. However, because blood thinners are quite dangerous drugs, it's just as advisable to mention to your doctor what you're going to do, because the doctor may want to reduce the dose of blood thinners depending on the effect that they get from the gel or the capsules. So it's a question of be safe and make sure that you inform the doctor if a customer is on a blood thinner. They should just talk to the doctor and say, we're going to start taking allicin from garlic and vitamin C, and it's possible we may need to adjust our dose in the future, but you're not going to over thin their blood, and that means they're not going to collapse or anything like that. So don't have any worries about that. So that's warfarin and Coumadin and all of those really significant blood thinners. And in fact, there's now 2 or 3 more modern ones. Plavix is one, where the allicin doesn't have any impact on it whatsoever.
Okay. Well, these slides are very impressive, Peter. I have heard, you know, people that have had COVID, that's one of the things that happen. Because COVID is the cells, you know, do coagulate, and even after the immunization, that happens as well. So what an incredible thing to take to keep that at bay, no matter what's going on. So
well, it's quite remarkable what it can do, and it can do it really quickly, and it continues to do it right the way through your treatment period. And it's the kind of product that really you probably should be on every day, continuously, because obviously we're always putting things into our bodies that are going to affect the way our blood clots and the way our blood cells stick to each other. Coffee, for example, is the key example. As soon as you start drinking a cup of coffee, within 15 minutes, if I took a sample of your blood and looked at it under the microscope, it would be just like the first picture on your magazine there. It would be all clumped together and rolio. That's what coffee does to you.
wow.
And for some people, they're very sensitive to caffeine. And again, I had a great doctor friend who after 2 cups of coffee would be shaking like this. So we tested him, and you would not believe how rolioed and stuck his blood was after just 1.5 cups of coffee. It was incredible. And obviously that was then reversed by using the HeartLife. So it's very effective. It's very quick action. I was even surprised at how quickly it acted, to be honest. I didn't know much about dark field microscopy when we started this particular product, but I learned a lot very, very quickly, because my colleague did me to start off with, and we looked at my blood, and I'm a great coffee drinker, so it was heavily rolioed and stuck together. And I was a bit gobsmacked because I'm a diabetic, so I'm supposed to look after my blood and circulatory system. And he said, look what happens as soon as we start giving you this stuff, this powder. And he showed me live on the screen, and you could see the blood cells beginning to normalize their shape and split apart. I couldn't believe it. It was like literally instantaneous. And to be fair, they've done other supplements since then. Like a lot of the berries do that immediately as well, like goji berry, and pomegranate does it very quickly as well. So it's not as if it's unusual. It's just that I hadn't seen it like that before. So it's very, very effective on your blood. That's really important as you age, because as I mentioned before, as we age, all of the arteries and all the veins in our circulatory system get a lot stiffer, and they don't flex so well. So it's much more difficult to get blood around the cardiovascular system. And what that means is your heart has to work harder and faster. And that means that you age that heart much quicker. And you can even start enlarging the left-sided heart muscle. And that can then lead to a heart attack or a stroke or even worse. So it's well worth looking after your heart, particularly once women get past the age of the menopause, because their risk of heart disease reaches the level of men within a few months of finishing the menopause.
Wow, I didn't know that. I'm going to interrupt for a moment.
Sure.
So that's probably all we will have for our call today. We can stay on afterwards after I stop the recording. But I did want to just share what Mary Beth was showing. Was our health news. It's an older publication that Peter sent us quite a few of. And the pictures she's referring to are, we'll put this up on our website on one of the blogs, but these are the pictures, the before and after pictures she's talking about with Peter's blood cell pictures. And then also this is just what our Alligin looks like. It's our silver bottle. And then we also have our Alli-C, which is the allicin plus vitamin C and bioflavonoids. And then this is our Alliderm gel that is aloe vera based. So like most hand sanitizers, it doesn't dry your hands out if you use it, which they're mostly alcohol based. So this is one of my favorite things. I keep one in my car, I keep one in my purse, and I just, like I said, put a little dab, dime-sized dab, and then I apply it in my nostrils, and then I just rub the rest in on my hands for hand sanitizer. And I like the smell, so take a little sniff, and it goes away about after a minute or so. But thank you so much, everybody, for joining us. And Peter, did you have a closing statement you wanted to make? I'm just going to stop the recording after.
Not really, Jasmine. I think we've discussed the role of allergen in treating things like bacterial infections, and the use of the gel as a topical treatment for any kind of small wound or anything, any kind of skin condition that might trouble you. The gel is a really head to toe product. It can be used all over the body, and it can be put into literally any orifice except the eyes, and it will give you great benefits.
Great. And as promised, there is a code for coming to this call, and it is Ask the Doctor 2. Just all spelled out one word, Ask the Doctor, DOCTOR, the number 2, and you can get $10 off your next order before December 1st. And I am going to stop the recording now, and we can wrap it up.